Hello, everyone. Thank you for the opportunity to present these results. I'm presenting here on behalf of the initial authors. This was the CE mark trial, and this is my disclosure slide. So I'm doing educational activities for Johnson & Johnson and Implantica, but the main authors of this study have declared no conflict of interest. So let's look at the background. I just presented in the other room a little bit more detail and the video of this procedure. So the Refluxstop is an implantable silicone device used in the laparoscopic surgical treatment of reflux. It restores and maintains the lower esophageal sphincter in the abdominal cavity in a kind of supernatural position, and it recreates the flap valve by an esophagogastric plication, like you see in the picture here. So it's about 90 to 110 degree plication. And by having this silicone implant made out of 5 pieces close to the esophagus in a high fundic pocket, we intend to avoid slippage into the chest, or on the other hand, keeping as much esophagus possible in the intra-abdominal cavity to have an augmentation of the LES pressure. So the idea is that it avoids side effects like dysphagia and bloating seen with traditional fundoplication, and the objective here was to determine the clinical outcomes with the Refluxstop device at 4 years after implantation. The earlier results have already been published. I just showed some slides in the other room from the initial study from Bielovich, and I borrowed some slides here from Professor Schopman. Thanks very much. Next are the methods. It's a single-arm prospective multicenter clinical investigation on safety and effectiveness. So this study was performed in 4 hospitals in Hungary and Serbia between December 2016 and September 2017. The 1-year results were published. Last year, the 3 results were presented, and here we present the 4-year outcomes. 50 patients, so this is the first ever cohort to receive Refluxstop. It's a selected group because there were exclusion criteria, so no patients with prior reflux surgery or bariatric surgery. Hernias, so patients with hernias over 3 centimeters were excluded. Esophagitis, LA grade D, and Barrett's esophagus was excluded, and patients with BMI over 35 did not receive the Refluxstop. So these are the baseline population characteristics as written here. So there was an annual review with GERD HAQL score, PPI usage, and adverse events, including dysphagia and bloating. There was an assessment of 24-hour pH in all patients at baseline and at 6 months. These are in the previous publication. Cases of possible treatment failure had additional pH monitoring and contrast swallow imaging for further investigation. Data availability and patients lost to follow-up. So data was available on 47 patients, 44 with 4-year data and 3 with the 3-year data. So 3 patients terminated the study during the first year. And of the 3 subjects with 3-year data, 1 patient died from COVID between year 3 and 4. So when we look at GERD HRQL in this cohort as a primary effectiveness outcome, we see consistent improvement over 4 years. The median score of the GERD HRQL at baseline was 29.5 and reduced to 3 at 4-year follow-up, led to a 90% improvement. 2 patients were dissatisfied in the quality of life question, though the normal pH, so the pH monitoring was normal, indicating that there was dissatisfaction in those 2 patients other than for acid reflux. Regurgitation was controlled in 95% of the patients who had no or minimal regurgitation at the 4-year follow-up, and this was stable over the 4 years as we see in this slide. PPI use at year 4, 96% of patients did not take regular daily PPIs. So 2 patients were taking regularly PPIs, though the 24-hour pH was subsequent normal. And there were only 6 patients where the pH study was repeated after the 1-year results. And there was 1 pathologic result, but the patient was not taking regularly daily PPIs as he felt to be asymptomatic. What are the postoperative adverse effects? So that's interesting for us regarding the safety profile, and we see really minimal adverse events. There were no device-related adverse events, so there was no migration or explants during the entire study period. There was no esophageal dilation needed as with this procedure, as there is no partial or full wrap. It's really a plication, which is like a 90-degree wrap. So the esophagus is not encircled, and therefore no esophageal dilation was needed, as none of the dysphasias was seen severe enough for dilation. So there was one patient with dysphagia in this group. Conclusion, so these results confirm that the excellent 1- and 3-year outcomes that are already in publication are stable long-term to 4 years, supporting the safety and effectiveness of the Refluxstop device in treating GERD. GERD HAQL scores, pH testing, and pH usage indicate treatment success and minimal side effects without causing dysphagia or gas bloating. And the favorable low rate of adverse events is attributed to the Refluxstop's dynamic physiologic interaction, as it's non-encircling the esophagus and keeping a long segment of distal esophagus in the abdominal cavity to be augmented by the abdominal pressure. Thank you very much.